So how do you know if you have poor nervous system health? How do you know if that is the root cause issue?
It's a really good question. I mean, there can be, of course, like actual nervous system diagnoses that somebody has like MS or like autism spectrum or bipolar, something that's very obvious as a nervous system pathology. But outside of those specific situations, if it's kind of like what we would call a functional neurological disorder, or like we basically don't really know what's going on, it seems like they're making it up in their head. That's what a functional neurological disorder means. It's like, oh, it's psychogenic. It's coming from your mind. And there's a whole new branch of neurology that's focusing on this. And so definitely if somebody's been diagnosed with an FND, a functional neurologic disorder, no doubt there's something going on with the nervous system. The other biggest thing is just the perception of feeling extremely stressed all the time. And especially if it's impacting your sleep or your ability to function with other people. If you're really anxious all the time, either social anxiety or just free-floating anxiety, a lot of worries, a lot of fears, not feeling safe in your body, not feeling safe in certain situations, not trusting your body, having a lot of anxiety or fear around your health, definitely the sleep being impacted, and just this sense of never being able to relax and a sense of never being caught up. In our society, we're all so overloaded with work, pretty much all of us. Even if you're a stay-at-home mom, you're still super overloaded with work all the time. So this feeling of, they've actually done studies on this, when that to-do list is never ending and you're crossing things off, but it just keeps adding and you're crossing it off and you're adding, that sense of never getting to completion, never getting everything crossed off the list actually really debilitates the nervous system, because you feel this chronic, I'm always behind, I'm always behind, I'm always behind. And that's a very clear sign that your nervous system is dysregulated. Now, it can also be, the other big signs are feeling depressed or demoralized. That can go along with all of that too. Again, I'm never keeping up. There's something wrong with me. So a lot of negative self-talk, nervous system's definitely dysregulated. And then the other, for women, hormones being out of whack, almost always, I wouldn't say always, but almost always, there's a deep stress component there. So that needs to be looked at. And then also digestive issues, chronic digestive issues that won't go away. Especially, I see patients all the time, they've gone to a gastroenterologist, they've gotten imaging, scoping, tons of testing, stooled, everything looks fine, everything looks normal. No way to explain it. We don't know, it's idiopathic, try these drugs, whatever. When you can't figure it out and everything's been ruled out, chances are, I have had other fringe circumstances where I've diagnosed something really rare in these situations, but 95% of the time in that situation, can't figure it out. It's the chronic unremitting stress affecting particularly that parasympathetic rest and digest nervous system, or the vagus nerve. That's totally dysregulated, and the body, because it's never feeling relaxed, can't digest properly.
Yeah, I think this is such an important conversation, because sometimes when we're stressed, we feel like it's a sucky feeling now, but we don't realize that it's actually having long-term effects on our nervous system, which can manifest in these things that we talked about, like immune issues, anxiety, digestion issues, pain, reproduction issues, cancer, all these things. So it's just another reminder for all of us that we live in a crazy world, but it is important to get that in check, because it's a real physiological thing that's causing physiological effects long-term.
Yeah, and you said something that I also forgot to mention, chronic immune dysregulation. Again, when especially when like somebody's either immunosuppressed or they have really high inflammation, and there's nothing a doctor can figure out is like the cause or what's driving it. 95% of the time, it's going to be this chronic stress, and chronic stress, depending on how long it's been going on, can either suppress the nervous system, again, so we get sick all the time, or ramp it up and make the immune system more inflamed. And that can lead to things like autoimmunity. So either way, it can go in either direction, but any of these kind of like weird, we don't know, idiopathic situations are almost always nervous system mediated in some way.